Great. Hello, everybody, and welcome to Ask the Physical Therapist, hosted by the MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, the Educational Programs Coordinator for MS Focus, and I'm joined by Dr. Herb Karpatkin, who will be spending the next hour with us answering all your questions about physical therapy and MS. Now, I'm delighted to introduce him. I know that all of you have seen his larger bio that's in the registration site, so I'm just going to give you a few little tidbits about him. Dr. Karpatkin is a doctor of physical therapy who is board certified in neurology and geriatrics. In addition, he's also certified as a multiple sclerosis specialist. Dr. Karpatkin, we're so pleased to have you join us again. Always love your Q&As. And once I give everybody a little refresher as to how to submit their questions, we can begin reading those out to you. So if for anybody that hasn't been here before, that's not familiar, you are going to keep all of your questions or comments to Dr. Karpatkin in the Q&A area. Do not just pretend that the comment section isn't there, or rather not comments, but the Q&A and the chat. We're going to prevent people from going into the chat. We're going to keep that just for the people that are viewing from Facebook. We're going to do all of our Q&As, and that is where we're going to pull them from. So anyway, so if you want to do this out loud, if you'd like to just press 9 on your phone and you want to ask your question out loud, you can do that. Also, if you want to just raise your hand and you want to ask the question directly to him, I can unmute you. And you have to, of course, unmute yourself. And we'll go from there. So once I call on you, you can ask all the question you'd like. One at a time, though. So, okay, let's see. Let's go to see how many questions are there. Let's see. Okay. Elizabeth says that she's in a blood flow restriction treadmill trial. And she understands that you have a publication about this. How did it go and what are the results?
I'm glad to see that you're in a trial. Helping with research is something very valuable that you can do. I was a co-author of a paper about a year and a half ago on the topic. It was a single case report of somebody with MS who we described the use of blood flow restriction training to allow her to do a greater volume of work with less fatigue. And we got good results, which is why we published it. The idea behind blood flow restriction training is it's another way of training for people with MS that allows you to perform a greater amount of work with less fatigue. And that's kind of the holy grail for a lot of MS researchers such as myself. The overarching problem for MS and exercise or MS and physical therapy is to get the best results, you have to do a certain volume of work. And it is the nature of MS that the fatigue makes it difficult to get that volume of work. So a lot of the research that I and a lot of my colleagues do is specifically to say, what can we do to make sure persons with MS can perform enough exercise to get the best result? So I've done research into intermittent training. I've done research into using cooling vests. I just literally an hour ago, I completed a meeting looking, we're going to be looking at different breathing techniques to try to improve exercise response. And that's really, to me, one of the most exciting places for MS research right now. What can we do to allow persons with MS to train harder?
Hmm,
Yeah.
very good question, Elizabeth.
And thank you again for being in the study.
Yeah. So how can someone safely build strength without triggering fatigue or flare-ups?
That's the multi-million-dollar question, and thank you for asking it. Um, the most important thing, well, there's no one most important thing, but if I had to say there was one most important thing, it's to take breaks. Um, what I've found in both my research and my clinical practice is persons with MS can actually perform a fairly significant amount of work, but they have to take breaks. Now, we published a study looking at something called high intensity training or maximum strength training in MS. And we actually gave persons with MS very heavy weights to lift. Instead of the standard 70% of the 1 rep max, we went all the way to 90% of the 1 rep max. But we did relatively small numbers of reps, 4 reps, 4 sets of 4 reps with long recoveries in between. And our subjects just loved it. Not only did they get much stronger, but their walking improved and their balance improved. So they lifted really heavy weights. It was a really aggressive program. But because we gave long breaks in between, the recovery was enough for them so that the fatigue never became a problem. And right now we're probably just a few months away from finishing data collection to a larger study um, where we're comparing again maximum strength training, 90% of the 1 rep max, 4 reps, 4 sets, to more conventional strength training, which is about 60 to 70% of the 1 rep max, and 3 sets of 10 with short recoveries. We're finding that both groups improved, but the high intensity group did much better and with fewer adverse events. We finding that there's more injuries and more dropouts with the so-called gentler group. So it's food for thought. The key is work out hard, but take long breaks. Your body will
Mm.
respond really well to it.
I love hearing you talk about all the research because I don't often get to hear that. Thank you for doing that because
Oh,
it's,
it motivates me like nothing else.
yeah, I hear about medical research, but I don't hear about the physical therapy. So it's really exciting to hear that. So James is asking that he occasionally gets sciatica pain extending into the buttocks and thigh. Do you
Mhm.
have any recommendations to improve this on either side of the body?
Sure. That's not an uncommon thing in persons with MS. Sciatica refers to an inflammation of the sciatic nerve. It exits the spinal cord in the lumbar spine and then basically travels out the back and down the back of the leg. And sometimes sciatic nerve can be so bad it goes all the way into the foot and into the toes. It is usually related to posture. Okay.
Mhm.
And it's related predominantly to a flexed posture. And what that means, I don't know you, James, but so forgive me if I'm off base here, but where I see a lot of persons with MS who are experiencing sciatica is they sit too much. They're always flexed. So when I do have a patient with sciatica, whether it's somebody with MS or anything else, that's one of the first things I check. Are they sitting too much? Are they bent over too much? And I give them lots of extension exercises, tell them that when they sit, they should make sure, if they sit, make sure they're not so slumped over. Okay? And they also need to strengthen not just their abdominals, but their low back muscles. Okay? But one of the first things I look for when someone with MS tells me they have sciatica is, do you sit too much? And second, can you reverse the curve in your spine? If your spine is flexed, can you do exercises to extend them? And what I'll say right now, I can't, show them to you in this little talk, but the MS Foundation has been very good about sharing my email. And if you want to send me an email, I can send you some specific exercises to work on that should help you with your sciatica. But um, think about how much you sit. Think about if the sciatic pain is related to your sitting, and that gives us an idea of where it's coming from and how to treat it.
Nice. As you're talking, I keep reminding myself of your phrase that you use. If you want to move it, you have to move it, right? I think
Yep,
that's what you say. You want to
yep,
move your foot, you got to move your foot. If you want to move things, you have to
yeah,
move that thing. So,
correct.
so Elizabeth is asking, or rather, she said, I'm fascinated by the breathing and exercise study you're doing. Where can I find more on this?
Oh boy. Well, right now, probably the only place is to listen to me because we just had our first planning phase. Um, the idea behind it is to, and so it sounds a little bit wild, but the it's a technique that's been used successfully in persons with traumatic spinal cord injury. What it's called is intermittent hypoxia, where the person, instead of breathing normal room air, breathes a breathes through a mask which decreases the amount of oxygen, and it makes the work that is done more difficult, but with less uh, but with less physical trauma. So it's similar almost in a way to blood flow restriction training. It also has been shown, and the researcher who I was speaking with, it also has been shown to really stimulate neuroplasticity, which is the goal of a lot of the exercise we do, not to change your muscles, but to change your brain. So this study is a long way. Um, we're still in the planning stage right now. We probably won't be, doing data collection until probably till the fall. Um, but if you want to find out more about the idea behind it, you should look into intermittent hypoxia training in spinal cord injury, because
Thank
that's where the idea is coming from.
you. Carol has a great question. Have you ever written a book about MS for MS people?
Oh,
Is it on
I'm
the horizon?
it's come and go. Well, yes and no. Um, I am writing a book right now, but it's more about about physical therapy in general and the stories and what I've learned from my patients and what it's been like to work with persons, mostly with MS, but also persons with stroke or spinal cord injury or brain injury. Um, I approached a book publisher uh, a couple of years ago to write a book about physical therapy and MS, and he was interested, but in the end, they decided not to go ahead with it. But maybe I need to revisit that because there's too much information that is not getting spread around. So I may, with some of my colleagues, make that a project for the summer.
I'll
Get
buy
started.
one. I'll buy
Okay.
one. The
Well,
foundation will put it in their library and we send it out free to
well,
people. So
okay. Um, will they will they fund me is really the question.
will
Different
they
thing.
fund you? That's
Yeah.
a good question.
Yeah.
Good question.
But it's
Yeah.
thank you for asking that question because it's something I really do need to do. And I'm gonna see if I could see if in my spare time I could put something together without my wife
Nice.
knowing about it, of course.
So we have a 51-year-old female recently diagnosed with MS, 30 minutes a day on treadmill seems to work. Mild symptoms. I guess they're telling you that and are asking for some validation if that's good.
So firstly, excellent, not just good. Um, the walking 30 minutes a day on a treadmill is going to have a lot of positive things. Firstly, one of the most common complaints of persons with MS is its impact on walking. At least 9 out of 10 people with MS complain about it. I think the number is much higher. Um, the main reason that persons with MS often have trouble with walking is they don't walk enough. And so making sure that you do your 30 minutes a day is great. Also, persons with MS who exercise normally almost always have a less severe course of the disease than those who do not exercise. There is something about about exercise that seems to be neuroprotective in MS, that the disease literally does not have as much of an impact on you if you exercise chronically. And it's one of the more important things. That being said, realize that I'm a PT before anything else. And one of the things a good PT should always try to get you to do is more. So 30 minutes a day is good on a treadmill. Um, you should try to intersperse that with, instead of 30 minutes on a treadmill, occasionally do 30 minutes outside, because walking outside is different than a treadmill. And don't just do it outside, do it outside with uphills and downhills and uneven terrain and crowds on windy days and on hot days. The more variation that you're doing, the better. A limitation of the treadmill, and it's not an enormous limitation, but it's a limitation, is 30 minutes of walking on a treadmill is going to get you really good at walking on a treadmill. And in real life, you don't walk on treadmills. So the treadmill is great for things like, getting your heart rate up and getting circulation through your legs and things like that. It's outstanding. But you can add to it in certain ways. Um, does it get you out of breath a little bit? If it doesn't, then maybe you want to try speeding it up a tiny bit. Does the treadmill have some hills that you can do? Or do you do it completely flat? You should probably add a little, every 3 or 4 minutes, add a 5% grade for 30 seconds. Okay. But the variability can really, really help you. So it's great that you're doing it, but remember, I'm a PT, so no matter how good you do, I'm always going to want you to do a little bit more.
Thank you. Are there summer specific techniques to conserve energy, like posture changes, water activities, or even pacing tricks?
Um, I don't like I'm not a fan of the idea of energy conservation, um, because to me that means you're doing less. And I want people with MS to do more. So I will perhaps rephrase the term energy conservation with energy maximization. How can you make the most of the energy you have? Um, so and this is something that a lot of my research is based on. If you want to walk a longer distance, don't try to do it all at once. Walk, for 5 minutes and then rest for a minute. Walk for five, rest for one. Walk for five. You'll walk a much longer distance than you would if you did it continuously. So taking breaks is probably one of the ways you can get, the greatest bang for your buck in terms of energy that you have. Um, Especially with the warmer weather coming. Right now, I'm in Nova Scotia at this moment where it's a little bit chillier, but with the warmer weather coming up, learn to start using an ice pack. We just published a study and we just concluded another study where we showed that ice packs are amazingly effective, ice vests, excuse me, amazingly effective at improving walking and improving balance. Uh, there's zero question about it. In one study, we had patients do a 6-minute walk, either wearing an ice pack beforehand or not. And not only did the ice pack group walk a much longer distance, but most of that improvement was in the last 2 minutes of the walk. Generally, most persons with MS slow down over the last 2 minutes. That didn't happen with the ice pack, and that was pretty amazing. And then we did another thing looking at balance, where we uh, took patients with MS, we measured their balance, and then we put them on a stationary bike and had them bike hard for 20 minutes, either wearing an ice vest or not wearing an ice vest. The group that didn't wear the ice vest, their balance got much worse. The group that wore the ice vest barely changed at all. So if you're looking to conserve energy, you have to control how much your body heats up. One way of doing that is by wearing an ice vest or a cooling vest. Another way of doing that is to take breaks. Both work. You know, I've my research shows it, and my work with my patients has confirmed it.
Great. And how much exercise? I know you touched on this also with all the talking about exercise, but how much exercise do I need to complete every day, every week? Is it best to change the variety of exercise? What exercise is best for foot drop? And do you have a website or email? Which, of course, we can get to them.
That's a lot of questions. Why don't we start with the first one? How much should you do
Every
every
day, every
day?
week.
Um, I have no idea because I don't know you. The problem with a question like that in MS is one of the most highly variable neurologic movement disorders in the world. And so what might be the right amount for you might be a too much for somebody else or too little for somebody else. It depends on many factors, including how the severity of your disease, um, what kind of shape you're in uh, already, what do you want to accomplish with exercise? Um, what do you, uh, what's important to you about the exercise? So that's the first question. What was the second question in there?
Is it best to change the variety of exercise?
Yeah. Uh, well, yes and no. So very often patients will come to me and say, I need to do a very specific task, and so I will put together an exercise program for them to help them achieve that task. And it's a very specific protocol that they follow. For some patients, uh, the who don't have a very specific protocol to follow, it helps them the most to get the greatest amount of variety. In the answer I gave before about the woman who is walking on the treadmill for 30 minutes a day, I said you'll get more benefit out of it if you change it up. You do some days on the treadmill, some days not on the treadmill, some days, on uneven terrain, some days, on smooth terrain. So variety makes the brain more plastic. Variety, the more your brain has to respond to, the healthier it is. So, although you will definitely, if you do the same exercise every day, you'll definitely benefit from it, but you won't get the brain plasticity you would from it otherwise. Foot
Okay.
drop, a question I get asked about a couple times a week. One of the most common findings in MS. It basically is a result of a couple of things happening, usually tightness in the muscles of the calf, or called the plantar flexors, weakness in the muscles of the shin, called the dorsiflexors. Um, there's often some stiffness or spasticity involved, and but most importantly is a lack of use of that leg. Generally, I see this vicious circle where their foot starts to drop, so they walk less, which makes the foot drop more, which makes them walk less, etc. So the most important thing you can do is to stretch that calf muscle. And if you send me your email, I'll send you some not just calf stretching, but a whole exercise protocol for foot drop that I recommend. Um, the but the most important thing you can do is to keep walking. It's this cyclic thing, and I've just been seeing it for years and years, that walking gets a little bit harder, so the person walks less, which makes walking harder, which makes them walk less. And what you really need to do actually is walk more. You know? Form follows function. If you do the walk, your legs tend to adjust to it. Just a quick story from one of my research projects. Um, in a study we did, we're almost completed with it right now, but one of the first subjects, we had her walk uh, high intensity walking, where she would walk for 30 seconds as fast as she could, and then sit and rest for 1 minute. And she would do that for 20 minutes, 2 to 3 times a week for about 6 weeks. And one of the more interesting findings in that study, of course, her walking improved tremendously, but what also happened was her foot drop improved. We didn't do any stretching, we didn't do any strengthening, but but as a result of her using that foot much more and much more aggressively, her foot improved. So,
Thank you. One more thing, she asked about the website or email, and Bhavia did place your email up in the chat
good.
area.
Yeah,
So
reach out to
everybody,
me and I'll try to, I, I usually get a lot of questions, but I'll try to get to them all before the end of the week, if not earlier.
thank you. So it's all there if anybody wants to jot that down.
Great.
So Aaron sent me a paragraph that unfortunately doesn't have any periods in them or there's, so I'm going to try my hardest. Aaron, I'm sorry if I don't say it the way you meant it, but I'm seeing many barriers for assistive technology for people with SCI
Spinal cord injury.
in early stages of rehab. Are there good avenues for recreational assistive technology and MS Foundation? I think maybe we should stop the question and are there good avenues for recreational assistive technology? No, I'm seeing many barriers for assistive technology for people with
I'm reading the question. Not quite sure see, um, a lot of my I'm going to try and answer it as best I understand the question. Um, I, assistive technology has a huge place, in MS. Uh, but assistive technology is a very, very large field. It can mean anything from automatic controls on your laptop to turn on lights and things like that to functional electrical stimulation to help you move your legs. Um, I am not a big assistive technology person. I just don't have that training. It's not a big thing for me. Um, but there is um, and if you contact me by email, I can get you in touch with some people who are more knowledgeable about it than I. That's fine, but it's not a specialty of mine. So reach out, send me your email and I will send you some places to look.
Thank you. Thanks for the question, Aaron. How much exercise do I need to, oh wait, we already did that one. My right knee hyperextends when I was, something exhausts me. I guess when she exercises, it exhausts her.
Yeah.
Lori,
So the hyperextending, I'm assuming you mean that it snaps back. Um, and there's a very specific term for that. It's called an extension thrust. It is almost always due to a foot drop. Okay, that because your toes don't come all the way up, your knee compensates by snapping back. And although it's a little counterintuitive, one of the things you must do is start stretching those calf muscles. And again, send me an email and I will send you the exercises that you can do to improve your foot drop. Um, the patients I have who have that knee hyperextension or extension thrust, who follow the protocol that I show them, find improvements within a few weeks after starting the program.
thank
It's
you.
not immediate. The knee hyperextension and the foot drop usually occurs over a period of months, if not years. Okay, and so it takes some time to reverse it, but it can be done. My patients have shown me that.
Thank you. Does riding on a stationary bike have any benefits? Because they
It
have
sure
knee issues.
it sure does, but not as many as I would like. So on the positive, you definitely benefit from the aerobic workout. Your lungs benefit, your heart benefits. Also, riding, anything that gets your heart rate up is going to cause your brain to secrete a substance called brain-derived neurotrophic factor, which makes your brain more prepared to learn new things. Um, it's good for weight loss, it's good for bowel and bladder function, all good stuff. What's the limitation? If you ride a stationary bike, you will get very good at riding a stationary bike. So if your problem is with balance, riding a stationary bike isn't going to help you. If your problem is with walking, riding a stationary bike isn't going to help you. What's going to help you? If you have bad balance, you have to do balance exercises. If you have trouble walking, you have to do walking exercises. So I'm not saying don't do it. I think there's a lot of positives there, but you have to realize there are limitations to what you will get out of it. And
Mm.
so I'm not saying don't do it, but I'm thinking you can add other things to it.
What if your balance nerves are already gone?
Sorry, what if?
There's a question, what if your balance nerves are already gone?
Um, I don't know what that exactly means, but there has, I'm gonna go out on a limb there. I have never had a patient who's come to me with balance problems whose balance issues did not improve. Um,
Okay.
uh, um,
We can
yeah.
ask her to give us more information on that.
Yeah,
Antoine,
yeah, I don't know what balance nerves being already gone. If you already have poor balance, I promise you balance exercises will improve. But the thing is, you you have to do very specific balance exercises. And again, if you email me and send me, tell me what sorts of balance problems you have, I can send you some exercises to work on.
thank you. Bonnie says, what's the best treatment when you have fatigue and just want to sleep?
Well, the best treatment, uh, my first question is there's a um that sounds more of a medical issue than a PT issue for fatigue. There's a medication called modafinil, which I know patients with very similar complaints have used. Um, there's a that's the generic name. I'm blanking on the name for the trade name for it. But And that is something you should ask your doctor about. Modafinil was actually originally developed to help people with narcolepsy. But that sounds like more of a medical issue than a PT issue, and you may want to speak to your MS doc about modafinil.
Thank you. Any suggestions for lifting with the upper body?
Um, it depends on what you wish to accomplish by the lifting. If you, if your upper body is truly weak and uh, you're having trouble lifting things up, carrying bags of groceries or carrying your briefcase or picking up your kids, you have to practice those things. One fairly common problem that I see is people tend to work out certain muscles much more than others. Um, the chest muscles, muscles of the chest and the shoulders and not the back muscles. And that actually leads to a lot of problems and a lot of back pain. So if you're going to do an upper body lifting program, make sure you work on your back muscles as well as your chest muscles.
And Elizabeth's asking, do you have any suggestions for knee buckling problems?
Knee buckling problems, again, a common thing. Um, I would, my quick answer which I give a lot is I would have to see why your knee is buckling and what you mean when you say buckling. Um, I rarely actually see knee buckling. I see more that knee hyperextension or extension thrust than buckling. Um, and I would like to know under what circumstances it buckles. Um, uh, if it's truly buckling, it usually means that there's a lack of strength in the muscles at the front of the thigh called the quadriceps. But again, true knee buckling is very rare in MS, and I'm wondering if it's more of the hyperextension or extension thrust. Um, and if that's what it is, again, I'm going to post those exercises for that tomorrow.
Thank you. Sharon wants to know if she should push through the fatigue and continue exercising.
Oh, that's a great question. Thank you for that question. Um, and the answer is yes and no. The fatigue should not stop you from exercising. What I have all my patients do is you exercise, and when you start to feel the fatigue, stop, rest, recover, and then get back to work. You can't
Mm.
push through the fatigue in MS. It's not a mental thing. It's literally your central nervous system not being able to respond anymore. And it's usually due to your core temperature being too elevated. And the more you exercise, the hotter your core gets. So take a break, put on, wear an ice vest if you can, take 5 minutes off and then get back to work. Um, I have patients who can literally exercise for hours as long as they take enough breaks. So don't push through. You can't win. It's not a question that don't lack the internal fortitude. The disease is designed to keep you from pushing through. So you have to have a sort of backdoor strategy for it, and that strategy is to take breaks.
Very, very smart to say that because I think a lot of people try to go through it and it's not going to do them any benefit. So, can you suggest balance and posture specific exercises?
I can suggest quite a few of them, but I think it would be better if you sent me an email and I could send you a whole list of them. The problem with balance exercises is when a patient asks to see me because they have problem with balance, that's not a generic term. Usually their problem with balance is very specific, meaning that they, can't balance with their eyes closed or can't balance with their feet close together or can't balance while they're turning their head. Um, and so the balance exercise I give them are specific to those needs. That being said, I will happily post all of the balance exercises that I recommend for people to anyone who emails me tomorrow. I believe I sent you guys a long list of exercises in years past. I don't know if that's still accessible, but that's where I would be pulling them from. Um, but I want to be clear to anyone, balance improves. Zero question about that. Okay, um, I've been doing this for 40 years. Balance improves, but you gotta do the work. Okay, and the work means doing balance exercises. Riding stationary bikes, not going to improve your balance. Walking on a treadmill, it'll improve your balance on walking on a treadmill. But to improve balance, you have to do exercises that truly challenge your balance.
Makes sense. So, someone's asking if stationary bikes um, help with blood circulation.
Yes, they absolutely do. Um, the reason for that is as you push yourself, your heart rate, as you push yourself, your muscles need oxygen to do the work. Oxygen is transported by the blood. Okay, so by doing any type of repetitive uh, exertional activity, um, the need for oxygen to be sent to your working muscles is going to de facto lead to an improvement in blood circulation. So it absolutely will do that. It's
Thank you.
another benefit of stationary biking.
Is there any exercise for trigeminal nerve pain around the ear to the forehead?
Oof, that's a tough one. Trigeminal nerve pain or trigeminal neuralgia or tic douloureux is one of the worst parts of MS that I know of. I've had it. I don't have MS, but I've had it. I know it's exquisitely painful. Um, the the medical treatments for it are not great. There is a surgery for it, but it's an invasive surgery. I know of a few colleagues who were able to get some improvements with doing some soft tissue mobilization of their jaw and their jaw muscles. But uh, most of the handful of MS patients I've seen who do have it, they manage it with various types of pain medication and meditation and things like that. I don't know of any exercises that have been conclusively shown to make a difference. For me, required oral surgery. Um, and that was pretty, it was extreme, but it was effective.
Good, at least there's a way to fix it.
Yeah,
That's
yeah.
comforting. Is there a particular cooling vest that you recommend?
Ah, I am so glad you asked. Because I get asked that question a lot. Uh, I gave a talk at the American Physical Therapy Association's annual meeting a few months ago, and I got asked that question, and I had a slide ready for it. And what my slide showed was uh, you can spend, you know, close to $1,000 on a cooling vest, or you can spend about 20 bucks. Um, because I'm not wealthy, for my research, I use the $20 one and it works just great. The $20 one is basically a canvas vest with a few pockets and you put ice packs in it. As a matter of fact, I still have the one that the Multiple Sclerosis Foundation sent to me years ago for my research. We still use it in our research. Works great.
Good.
Now, what are some complaints about it? Definitely not fashionable. Not flattering to the figure. Colors clash. But does it cool you off and allow you to do more exercise? Heck yeah. Works just as well as the fancier ones. So um, it doesn't really matter how you do it. It matters that you do it. Get a cooling vest and, time for me to put in my plug, the MS Foundation. I'm assuming you still have the free vest program.
We
Um,
do.
by all means, take advantage of that. It's going to be a hot, hot, hot summer, folks. Get yourself a cooling vest now and get used to using it. Get yourself two vests or one with extra packs so you can replace the ice packs after a while. Um, the evidence for it is unassailable, and uh, it'll simply make your lives during the summer 10 times easier.
Angelette,
Go ahead. Go ahead.
yep, Angelette asked that question, and we do have the foundation is currently our cooling program is open. It closes, I think, June 1st, I believe. But if you want to get your application in, anyone, it is by application process only. And you would have to go to the website or ask us to send you one, but you can go to our website at www.msfocus.org and go to the cooling program and
Yeah.
fill out the application online.
Oh, by the way, I just remembered the name of the medication to help with sleepiness is called Provigil. The which some of you may have heard of. The modafinil is the generic name, and the trade name is Provigil, and it's quite effective in that sleepiness part that is associated with MS fatigue.
Great, thank you. And also, Bobby, I just posted our website going right to the cooling program if you were to want to take that off of that tonight too.
Great, thank you, Bobby.
So, what is your opinion of vibration plates? What is the best way to use them?
Um, honestly, the uh, the evidence for it is not strong. Um, I found a few patients who said they like it, but there have been quite a few studies that have been done, and none of them have shown them to be of any use. There were some studies which claimed that it improved balance, but to be honest, the vibrations are so fine and so minute that they really, although they shook the person up a lot, I didn't see any improvements in balance. It's a interesting idea, but it would be great if it did something. I've not seen any evidence that it does.
Okay.
And it's kind of what I like to call it's a modality looking for a use. Um, you know, I would love it if it did. When I used to have my own private practice, I bought one of the machines and some of my patients really loved it. I couldn't tell if it did anything for them, but it kind of, jazzed them up a little bit. Some put the patients on it, it clearly made them worse. So
Okay. Are there any exercises for lactic acidosis?
lactic acidosis is a chemical condition where your lactic acid builds up usually as a result of exercise. Um, uh, and it leads to a greater sense of fatigue. This is not MS fatigue, it's more sort of a muscle fatigue that occurs. Um, if in fact what you are experiencing is lactic acidosis, then it means that your muscles have had insufficient training to perform the endurance work that you need, that you're trying to do. So if that is in fact what you're experiencing, um, uh, the intermittent training that I talked about before is going to be perfect for you. But so instead of trying to walk for long, long distances, try, the 2 minutes on, 2 minutes off, or 1 minute on, 2 minutes off, but whatever allows you to walk that greater distance so your muscles never realize that lactic acid fatigue.
Thank you. Becky says that she took Zepbound for about 3 months, but couldn't handle the side effects, so she stopped. She said, I think I lost more muscle than fat. So since stopping, I feel more fatigued and weak than I was before. Any way to build up more muscle without totally draining myself?
I don't know what Zepbound is. I've never heard of it. I'm going to look it up right now. Uh, let's see here.
Don't you love computers and cell phones? I love it.
Sometimes. Oh, here it is, Zepbound. Let's see. Oh, it's semaglutide. Uh it's the medication again. Oh, it's Ozempic, essentially. Um, yeah, I know. I don't know of any people with MS who are on it, but I know many people who are on it. And a lot of them are really dealing with fatigue as a major issue. So I could see why that's happening. But it's kind of a conundrum for people with MS because a lot of people with MS gain weight because they're less active. Um, the Ozempic can, certainly is effective at, the studies and what I've seen, it's very effective in weight loss, but it really can lead to a lot of fatigue for a lot of people, certainly not what people with MS need. So let me just read your
Mhm.
question again here. Um,
Well, I wanted to know if there's
yeah,
any
no,
way to
I'm reading
build
it
up
right now.
muscle.
So if you want to build up muscle, um, the protocol that I discussed before, use relatively heavy weights, excuse me, do a relatively small number of repetitions and take long recoveries. So, for example, say you want to do an overhead press, okay? Instead of, doing, 10 reps, you know, with 5 pounds, uh, do 5 reps with 10 pounds, and then take a long, and then recover for 3 minutes and do it again. So heavier weights, fewer reps, longer recoveries. Okay? And that works for MS, but it also works for anybody. a lot of the techniques that I study for my MS patients is stuff that actually is a lot is a modification of what top athletes use. You know, intermittent training, you know, when I was a track and field coach before I was a PT, and intermittent training is just a way of doing interval training. It's what I used to have my runners do. Uh, the high intensity strength training, this is something that professional weightlifters use. Okay? So I'm just adjusting it for the needs of people with MS.
Hmm, thank you. Are you looking for volunteers for your max training study or any other studies?
I am always looking for volunteers, but you know, I'm in New York City, so yeah, if you live there, that's great. Uh, and if it's something you want to do, you have my email, so contact me, and you know, if we can find a way to work you in, I will work you right in, I promise.
And we have an anonymous attendee who said that the use of the word exquisitely painful is absolutely adorable. They like that. I guess nobody's ever explained it that way.
Well, I've been called many things in my work. Adorable. That's a first. So I appreciate that.
Oh, how can you just use, let's see, how can you just use weights to lose weight while gaining muscle? Hmm.
The way you lose weight is by uh when your energy need is greater than your caloric intake, you know, or or be at a caloric deficit. Um, so anything that raises your metabolism rate uh, is going to burn calories. So you could do it by walking, you could do it by weight training, you could do it by riding a stationary bike. The mistake a lot of people make with weight loss and exercise is they do the exercise, but they don't combine it with the diet. So the exercise burns calories, but you can't replace those calories with extra food. And a lot of times people will say, well, I exercised really hard today, so I'll have a second cheeseburger. And you'll get the benefit of the exercise, but the weight loss isn't going to happen. So you have to be in a caloric deficit. Or you can take Ozempic, which actually makes you want to eat less. But one of the reasons it makes you want to eat less is because you're exhausted a lot of the time.
Right. And Deborah's asking, what are your thoughts about the psionic sleeve?
Excuse me, I just got to move somewhere and plug in my computer. What are my thoughts about the psionic sleeve? I'm glad you asked. So the psionic sleeve, for those of you who don't know, is a type of functional electrical stimulation which is put over an arm or a leg and sends discrete electrical pulses to your to the muscles that are weak. Um, and if those muscles are weak for a certain part of gait or balance as a result of the MS, it will stimulate that muscle to contract. It's a good idea, no question about it. The problem is that walking and balance are extremely intricate, and it's never just one muscle. It's usually a combination of muscles, and it's not just the strength of the muscle, it's the timing, how the amount of force has to be appropriate for the task. It has to ramp up at a certain speed, it has to ramp down, it has to turn on at the right time, turn off at the right time with the right amount of force in conjunction with other muscles. And so devices like the psionic sleeve or the Bioness or the walk aid, um, I will say at best they may have some limited usage. I wish that I could say something better about them, but I simply have not seen them make a big difference. Now, there are a few cases where they do make a difference. For example, um, uh, it can it will make a muscle activate, and some people will put it on either the psionic sleeve or the Bioness. They'll put it on a sort of continuous setting, so the muscle is just contracting all day long, and that will make the muscle a little bit stronger, but it won't improve function. Okay. And I've been to a lot of patients' houses who have Bionesses or psionic sleeves, um, and they spent a lot of money on them, and the reps, promised them, big improvements, and they didn't happen, and they're gathering dust in the corner.
Hmm.
Um, I wish to God that wouldn't it be great if they were. So there's a lot of claims that are made for various things to help you with MS, and a lot of them are not supported by evidence. Um, I prescribe exercise because the evidence is there. Um, I'm comfortable with it because I personally have done a lot of the studies which have provided that evidence. And then I also do these things that the evidence suggests with my patients, and I get good results. If they don't work, I'm not going to do them. Why would I waste anyone's time? I care too much about people with MS to waste their time. But so, the psionic is a business, and they're in the business of selling the sleeve, and you know, capitalism and all that, that's fine. But uh, for me to recommend it, I need to see better evidence than they have thus far.
Thank you. Margaret would like to know if you know of an exercise that can help with the tingling that's going down her arm.
Um, Assuming that the tingling is from, so the first question is the tingling due to the MS? If it's actually shooting down the arm, it may not be MS and may be sort of the arm version of sciatica. You may
Oh,
have a condition um, called a cervical radiculopathy, which, and again, it's for the same thing. People sit too much with their heads too far forward, and that compresses the nerves coming out of the spine. Um, if the tingling is there 100% of the time, no matter how you move, it's probably the MS. If it's there when you sit but disappears, say, when you lie down or when you lie flat, then it's probably the radiculopathy, and improving your posture is going to help a great deal with that. If it's the MS, it's not something that can be treated with exercise. It can be treated medically. There's a medication called Neurontin or gabapentin, which you should speak to your doctor about, which has which has been shown to have some effectiveness in treating the types of what the nerve pain or neuropathic pain, as it's sometimes called. Um, but if it's a lot of times I'll see a patient who has that complaint and they'll assume it's the MS, but in fact, it's due to posture. And if that's the case, it's actually relatively easy to fix. Another thing you can do to see if it's nerve pain as opposed to radiculopathy, does the pain improve if you pinch your shoulder blades together and look up at the ceiling? Because that would take the pressure off the nerve. If that's the case, then you know it's not MS, which is good news.
wow. That was a powerful answer. Okay.
Well,
So,
I
Nancy,
was going for adorable again. Powerful. I get it. Looking for
no.
adorable.
So I'm going to make Nancy's questions the last ones
Okay.
because we're really at the end of the hour, unless you can stay another minute. But let's do this. She wants to know what exercises can help with leg tremors, and then the second question under that from her is there a reasonably cost-effective machine that can help with leg and hand tremors? So,
Oof. Again, I'd have to see why the tremors are there. Um, Tremors is a very non-specific term. Um, and uh, it could be any number of things. Um, uh, that I'm sorry, I really can't answer because um, tremors to me can mean about 5 or 6 different things. It could mean a spasm, it could mean a true tremor, it could mean ataxia, um, it could mean spasticity, it could mean disequilibrium. It's one of the limitations of this format. I really can't tell when somebody says something. Um, if she wants to write to me and give me a more clear idea of what she means by tremors, maybe I can be of more help. But right now,
Okay,
I
good
really
enough.
can't.
And
Give me
as
another,
far,
give me another
um,
question because I couldn't really answer that.
okay. And as far as the machine, anything about that, or we need some,
Again,
why?
without knowing what it
Okay,
is. Yeah,
good
sorry.
enough. She can write to you. At least we
Yeah,
have it up there. So,
absolutely.
what exercises can help with finger numbness from a cervical nerve compression in C6, C7?
Exactly what I was talking about before. Um, First thing to do, so um, pinch your shoulder blades together, look up at the ceiling and hold it. Email me and I'll give you more specific exercises to do. But that is literally exactly what I was talking about before. So the nerve compression or the cervical radiculopathy can cause the numbness and tingling down the arm, into the hand, and into the fingers. And it is an entirely, I get it sometimes because, I'm too much of an academician and I sit, over my desk, reading or writing sometimes. And that's the exercise that I do to reverse it. So, uh,
Okay,
yeah,
thank you. Well,
right.
that brings us to the end of our time. You did a great job answering all these questions. You're like
Oh,
the Energizer Bunny today. Wow. Um,
it's always a pleasure to do this. And, the
thank
MSF
you.
has been so, has been, is just such an outstanding organization. You've done such amazing work for MS. Unfortunately, the National Multiple Sclerosis Society has, for reasons not clear to me, taken a step backwards in meeting these sort of basic needs of patients. And the MSF has jumped in to fill the void. And
And
I'm so
thank
proud
you.
of you guys for doing that. You guys do amazing work.
Thanks for recognizing that. Again, I don't know exactly what's going on with the society, but I know that because they aren't helping as many people with the things that we help with, those people are coming to us.
Yeah,
So
well,
we
thank
have
God you're.
an abundance of people that we normally wouldn't, even more. So that's why we're trying to raise money so we can continue to help as many people as we can. So thank you for recognizing that.
Yeah.
And that does bring us to the end of our time. It was so much fun having you. If you missed any part of this conference, everyone, it has been recorded and it will be available through the MS Focus Facebook and YouTube channels. Please reply to your registration email for information on how to access the recordings or just sign up for our newsletter to learn about upcoming events. Also, you'll be receiving a short survey when you leave the conference. We'd really appreciate if you could give your feedback with that. It'll only take you a minute or two, but it really does help us determine what the most meaningful and helpful things are that you want to see for all of our attendees. Our next teleconference is Thursday, April 24th at 6:30 p.m. Eastern. The MS neurologist, Dr. Aaron Boster, will also be doing a Q&A for an hour, and we call that Ask the MS Expert. And other than that, our sincere thanks to all of our attendees for your participation, and especially to Dr. Karpatkin, who
Thank you very much.
continually comes back over and over to help us, even though he has a busy schedule, and just to educate all of us. And we really appreciate it. Goodbye, everyone, and we hope to see you next time. Thank you.